And we are back. Lots of questions today about hormone replacement, hormone therapy. Leesa Innenbach. Leesa is here with us to answer those. Body Shapes Medical. And Leesa, before we go to these phone calls, if you would please, you've got some specials going on I think people should be aware.
We do. I know everybody wants to get derby ready, summer ready, bikini ready, bathing suit ready. So we have a buy hormone package and get your weight loss package, your HCG package for half off. And also don't forget about our Exilus if you've got some troubled areas. That skin tightening and fat reduction using radio frequency. And if you buy 2 areas, you get 1 area free. So you just need to call the office at 425-0500 and get in there for your free consultation.
425-0500. Call them because these do go quickly. Every time we get on the air here, boom, it's done. It's finished.
Yeah, please leave a message. I would like to point that out too because they will call you back within about 30 minutes.
Good deals. We love that you do that for the show. Thank you very much. Let's talk to Michelle, who is calling from Austin, Indiana. Michelle, welcome to the show.
Hi. I actually have a question. I'm 34 years old, and out of the list that you all had just shown, I'm exhibiting almost every single one of the symptoms, but maybe one. I am a mother of 3 small children. 2 of them are twins, and then I have a special needs daughter. So I've tried to maybe convince myself that that's why I was having problems, just because I'm a stressed-out mother. Is it possible this early on to be having problems?
It absolutely is, Michelle, and that's a great question because we always talk about approaching age 40, but the fact is, with the stress in our life, that can decrease your hormones as well. So the best thing to do, again, would be come in, fill out a full health history, let's get some blood work, let's see what's going on. I mean, your levels may come back perfectly normal, and then I'll have to say, yeah, maybe it is your kids. But to be honest with you, with the stress that you're experiencing, it probably is causing some hormone imbalances, and we can do that with simple blood tests.
All right. Thank you for the call. I think we've got time to grab another quick one. Carol is with us. Carol's calling from Jeffersonville. Welcome, Carol.
Hello. Yes, I did the HRC hormone replacements probably about a year ago. I'm 39 years old, going to be 40. I had a full hysterectomy when I was about 24, 25 years old. I have not been on any hormones since then. When I did the hormone replacement last year, it worked terrific for me. I could not, express how good it helped me. I felt like $1 million, like I could run a marathon. I suggested it to a lot of people, but the thing is, I couldn't afford it any longer because they do not accept insurances and things like that. So my question is to you is, the cost. It blows my mind how people have to pay so much money in order to feel good and to feel back to their normal selves. I don't know what the difference is between your clinic and the HRC clinic is. I know they don't bill insurances. My insurance paid for the majority of it, but the thing is I had to send it in and wait for that money to come back. And by the time I had to go around to get my next dosage, I couldn't come up with $400 and $500 by the time they needed me to.
We do have a lot of payment options in our office, and what I'd like to point out too is, if you're not going to your regular physician and you're not being put on other medications that a hormone imbalance can improve, cholesterol medications, insulin medications, diabetes type things, then you've got to kind of factor in those things too. Do I really want to spend the money on a physician's visit where they're just trying to correct things that aren't really going to heal me and keep going back to those, or do I really want to find something that improves my life and keeps me on the right track? So you do have to kind of weigh out the benefits. I'm not really sure what HRC does as far as payment plans or options, but we do have plenty of payment options in our office. So again, the consultations are free, so just come on in and see if it fits into your budget.
Body Shapes Medical. Good answer. There we go. Let's grab one more quick one. I think we've got time to talk to Rhonda in Louisville. Rhonda, welcome to the show. Hi, Rhonda.
Thank you.
Getting ready for the big game, right, Rhonda?
Yes, I'm looking forward to it. I want to know what you can do to energize an 80-year-old woman.
Well, Rhonda, I'm sure that's a hormonal imbalance. Again, if you have done nothing since you've turned 40 and you've hit menopause, then your hormones more than likely are very, very out of whack, so to speak, with lack of a better word. So what we need to do is get you in there and get those levels where they need to be. Again, that's what I was talking about earlier. It's never too late to start this kind of therapy. Even though your levels are probably where an 80-year-old should be, we can get those down to where you were back in your 30s and get you feeling better and more energized.
And I've met Rhonda before. She is absolutely gorgeous. So she looks like she's 20.
She does.
Yeah, I know.
Well, maybe she doesn't need hormone therapy. Let's get her in there and find out.
We've got time to grab Teresa. My producer says phones are so hot. Let's just grab a couple more. So thank you. Appreciate that, Tammy. And we have, let me see, it's Rhonda. I think, no, wait a minute, Teresa. Teresa in Oklahoma. Teresa, welcome.
Hello.
Hello, Teresa. Go ahead.
Yeah, I got a question. I'm a 48-year-old female who's had thyroid cancer, and I've been clean for about 3.5 years, and that pushed me into menopause. And I was wondering, there's a lot of things going around where once you've had cancer, especially in that area, and with my age, is that you can't be on hormone therapy due to the cancer stigma.
Did you say thyroid cancer? I'm sorry, I couldn't understand you.
Yes, thyroid cancer.
Okay. Actually, you know, we just got back from this conference in San Francisco, and what they're finding is a lot of patients that have been on cancer, and it is a scary thing to talk about hormones and cancer. We would definitely want to take a team approach with your doctor and sit down with him. But the fact is, a lot of these hormone deficiencies are what are causing cancer. I was just talking to John earlier. They did a study with a bunch of men who actually had prostate cancer, and they always say, oh, adding hormones to prostate cancer is like adding fuel to the fire. Well, here's what they found. 54% of the men that got testosterone therapy, their PSA levels, which is the indicator of the cancer, actually went down. The other 46% were unchanged, but the other 54%, their PSA levels actually went down. So we really need to start looking at the new science and saying, wait a minute, is it really causing these cancers? Because what we're finding now in all these exclusive studies that we've been taught is that it's really not. So again, we would want to speak with your physician. We don't want to do anything that scares him or you, but it's definitely not something that would prevent you from being a candidate from bioidentical hormones.
And as you can tell, Body Shapes Medical, very dedicated to that medical supervision, which is very important to you. Give them a call today. All right, coming up, we're going to talk derby fashion, and we're still asking you. You can give us a call now, 571-5263, if you'd like. Hey, tell us, where are you going to watch the game? Are you going to New Orleans? You going to a big party? You going to a pub? Give us a call. Let us know. We'd love your input. You can go to wave3.com and click on the listens page. But coming up now, hey, derby fashion is just around the corner. You got to wear the cool stuff. Got to have the right gear for both the game and derby. We'll be right back on Wave 3 Listens.